What is kidney failure? Your kidneys are a pair of organs located toward your lower back. One kidney is on each side of your spine. They filter your blood and remove toxins from your body. Kidneys send toxins to your bladder, which your body later removes toxins during urination. Kidney failure occurs when your kidneys lose the ability to sufficiently filter waste from your blood. Many factors can interfere with your kidney health and function, such as toxic exposure to environmental pollutants or certain medications. Certain acute and chronic diseases, severe dehydration, and kidney trauma. Your body becomes overloaded with toxins if your kidneys can't do their regular job. This can lead to kidney failure, which can be life-threatening if left untreated. Symptoms of kidney failure. Usually someone with kidney failure will have a few symptoms of the disease. Sometimes no symptoms are present. Possible symptoms include a reduced amount of urine, swelling of your legs, ankles, and feet from retention of fluids caused by the failure of the kidneys to eliminate water waste, unexplained shortness of breath, excessive drowsiness or fatigue, persistent nausea, confusion, pain or pressure in your chest, seizures and coma. Causes of kidney failure. Kidney failure can be the result of several conditions or causes. The cause typically also determines the type of kidney failure. People who are most at risk usually have one or more of the following causes. Loss of blood flow to the kidneys. A sudden loss of blood flow to your kidneys can prompt kidney failure. Some conditions that cause loss of blood flow to the kidneys include a heart attack, heart disease, scarring of the liver or liver failure, dehydration, a severe burn, an allergic reaction, a severe infection, such as sepsis. High blood pressure and anti-inflammatory medications can also limit blood flow. Urine elimination problems. When your body can't eliminate urine, toxins build up and overload the kidneys. Some cancers can block the urine passageways, such as prostate, colon, cervical, bladder. Other conditions can interfere with urination and possibly lead to kidney failure, including kidney stones, an enlarged prostate, blood clots within your urinary tract, damage to your nerves that control your bladder. Other causes. Some other things that may lead to kidney failure include a blood clot in or around your kidneys, infection, an overload of toxins from heavy metals, drugs and alcohol, vasculitis, and inflammation of blood vessels, lupus, an autoimmune disease that can cause inflammation of many body organs, glomerulonephritis, an inflammation of the small blood vessels of the kidneys, hemolytic uremic syndrome, which involves the breakdown of red blood cells following a bacterial infection, usually of the intestines, multiple myeloma, a cancer of the plasma cells in your bone marrow, scleroderma, an autoimmune condition that affects your skin, thrombotic thrombocytopenic purpura, a disorder that causes blood clots in small vessels, chemotherapy drugs that treat cancer and some autoimmune diseases, dyes used in some imaging tests, certain antibiotics, uncontrolled diabetes, kidney failure treatment. There are several treatments for kidney failure. The type of treatment you need will depend on the reason for your kidney failure. Dialysis. Dialysis filters and purifies the blood using a machine. The machine performs the function of the kidneys. Depending on the type of dialysis, you may be connected to a large machine or a portable catheter bag. You may need to follow a low potassium, low salt diet along with dialysis. Dialysis doesn't cure kidney failure, but it can extend your life if you go to regularly scheduled treatments. Kidney transplant. Another treatment option is a kidney transplant. A transplanted kidney can work normally, and dialysis is no longer needed. There's usually a long wait to receive a donor kidney that's compatible with your body. If you have a living donor, the process may go more quickly. You must take immunosuppressive drugs after the surgery to prevent your body from rejecting the new kidney. These drugs have their own side effects, some of which are serious. Transplant surgery might not be the right treatment option for everyone. It's also possible for the surgery to be unsuccessful. Talk with your doctor about whether you're a good candidate for a kidney transplant. Kidney failure diet. There's no specific diet for people with kidney failure. The guidelines for what you eat will often depend on the stage of kidney disease you have and your individual health. Some recommendations might include: limit sodium and potassium. Keep track of how much you're taking in of these two nutrients. Aim to eat fewer than 2,000 milligrams per day of both. Limit phosphorus. Like sodium and potassium, it's good to keep a cap on the amount of phosphorus you eat in a day. Try to stay below 1,000 milligrams. Follow protein guidelines. In early and moderate kidney disease, you might want to cut back on protein consumption. In end-stage kidney failure, however, you may eat more protein, depending on your doctor's recommendations.